Hello and welcome to today's podcast. And the topic for today is inflammation. Inflammation, we're going to look at the two types of inflammation. We're going to also look at its symptoms and possible causes. And we're also going to look at how to reduce body inflammation. And so, what is inflammation? Inflammation is a natural response to injury or infection that helps the body heal. So, we can see that it's just a natural process, right? That helps the body to heal. So, how does this occur? It's usually triggered by the immune system, which sends white blood cells to the affected area. So, at times, maybe if you've got an injury on your hand, it gets swollen, right? It swells. That's inflammation. So it's a natural process, right? It's just that some red blood cells are going there, right, to heal that wound. So a lot of the times, inflammation is just natural process that helps us heal. Let's take note of that, because at times we panic because we have inflammation, we are swollen somewhere. However, just because there's a swell in our body does not mean that it's something too serious. However, there are two types of inflammation, right? There's the acute inflammation rather, and chronic inflammation. So there's the acute inflammation and the chronic inflammation, right? Now let's take a look at symptoms of inflammation. Now, this does not really matter whether it's acute or chronic. This falls anywhere there. One of these symptoms would be a redness, swelling, pain, right, and heat. So that swelling is it's painful and it's hot. It's got above body temperature heat on it. Another symptom is fever. So at times we do have fever. We are shaking with fever or just feverish. Usually this is just inflammation, right? Another symptom is feeling hot or losing function, our functionality. You can't think right, you can't walk right. It's also a symptom of inflammation. Another symptom would be discolored or flushed skin. Your skin is getting discolored of sort, sort of rash. There's a rash on your skin. That's also a symptom of inflammation. And another one would be having an inability to use the part of your body that you usually use normally. Your hand, you can't even pick up something. That could be a cause of inflammation. Picking up something that you usually just pick up easily, or just even walking, your leg, all of a sudden you can't walk straight. It could be inflammation. And so those are the symptoms of inflammation. Now, like I said, like I pointed out before, that there are two types of inflammation: the acute and the chronic. Now let's take a look at the acute, right? Now, the major difference between the acute and the chronic is that with the acute inflammation, it's usually a fast and short term response to an injury or infection, right? For example, you have a cut on your hand. That's an example. Yeah, the cut will easily be able to close in a matter of days, right? It heals in a matter of days, and even though it's swollen, but then it heals fast. So that's just an acute inflammation, right? However, for the chronic inflammation, it's usually abnormal, and the problem with this is that it can damage healthy cells and tissue organs, right? And usually also, and the major difference is that it persists for months or even years, right? If you're swelling somewhere in your body that's going for months and years, that's a chronic inflammation, and you should do something about it, because it means that there are cells that are damaged, there are cells that and tissues that and organs that may be damaged. So you should take a look at that. See, so that's the major difference, that the chronic inflammation, it goes on, it's persistent, it does not stop, and the danger, as pointed out, is that they may damage your cells, and so your body function won't be well, right? As opposed to the acute inflammation that just goes, the most would probably go for a week, right? Then, like a fever, just a fever. Fever doesn't last more than a week or so, to at least 2 weeks. Your body then gets back to its normal function. So usually it's really nothing to worry or get too worried about. But of course, you still have to see your medical doctor for any sort of abnormality, right? You still have to see a doctor for this, but not to be too alarmed when it's just an acute inflammation. What you should really be concerned of is a chronic inflammation that goes on and on. And worst off is that a lot of these chronic inflammations may contribute to other diseases, right? Like heart disease, cancer, and Alzheimer's disease. So that's why it's very important to not ignore long-term or long persisting symptoms. Should take or go to see a medical expert at this, a doctor, to make sure that this is taken care of. And so now let's take a look at how we can reduce body inflammation. And I'll just point out a few tips here, right? Eat plenty. Oh, number one, that is, eat plenty of fruits and veggies. Number two is to choose high fiber carbohydrates, food with high fiber. Number three, eat more fiber. Number four, choose plant-based and leaner animal protein sources. So this is very also important. If you're going to eat animal based protein, right, should be lean meat, and that's because, of course, lean meat has a high protein density. And last but not least, at least for my list that I'm exhausting here, is to reduce sugar intake. Those sodas, those Red Bulls, sugar in your tea, too much sugar, reduce that. You'd have to really reduce sugar intake, because it's one of those things that really contribute a lot to inflammation. Yeah, and so to wrap up, right, and just leave you with this pointer here, is just to remember that inflammation is a normal part of your body response to injuries and invaders, just like germs and times viruses. And once the immune systems attacks these viruses and germs, then you will feel better and stronger. So it's natural. It's something that's there, right? However, inflammation that happens when there's no injury or invaders, like I pointed out, germs and bacteria and things like that, can harm healthy parts of your body and cause a range of chronic diseases, right? So, like I mentioned, obviously these will be your chronic inflammation. That's when you now have to be serious about going to the doctor and seeing what your doctor has to say about uh, those symptoms, right? So watch out if you have a persisting sort of inflammation that has been going for a while. Make sure you go and see a doctor. But don't worry too much if it's just an acute inflammation, like a fever, short fever that has been going on for a day or two, or at most a week. So I'm going to wrap up now, and thank you. I hope this brought value, and stay healthy. Peace.